In this video, I'm going to share with you the three main factors that have helped both me and my patients decrease their hip pain and pinching from FAI and labral tears. I've also got a bonus tip that will make everything you do for your hip pain more effective. So make sure you watch until the end. Hi, I'm Dr. Nicholas Mercer, physical therapist and your guide to a pain-free life. If you've seen my other videos, you know I've struggled with FAI and labral tears for over 9 years, and even had 2 surgeries which made them structurally worse and more painful. This is the main reason I became a doctor of physical therapy, and my hips have progressively gotten better the more I learn about them. This past year has been the best my hips have ever felt, and it's because of the 3 main factors that I've integrated into my corrective exercise routine. If you're like me, you've been searching for answers all over the internet, just like I was 9 years ago. There are a ton of great exercises and stretches to help with FAI and labral tears out there. However, I've combined peer-reviewed research, experience treating patients, and my own personal improvement to bring the relief I've had to you all. Follow these 3 steps to eliminating hip pain and pinching from FAI and labral tears, and you will get relief. First, we have to talk about lumbopelvic instability. This is a condition that many people these days have to deal with because our lives are confined to a desk chair in front of a computer. Even in your early years, you probably spent 6 to 8 hours a day sitting either in class or on the couch at home. You've had a chair to provide some stability to your lower back and hips, so you haven't needed to use your muscles to stabilize them. Restoring this stability is one of the first things you need to do in order to get your hip pain better. In fact, between the research, results from my patients, and my own experience, this is the single most effective thing you can do for your hips. Since you have several different abdominal muscles, figuring out which ones are not stabilizing can be difficult. However, the Transversus abdominis, the deepest abdominal muscle, is usually a majority of the problem. Here's how to get started controlling this muscle. Lie on your back with your knees bent and your lower back flat on the ground. Place your fingers 2 inches outside of your belly button and 1 inch down. Keep your face and hips relaxed as you inhale as much air as you can into your belly. As you exhale, purse your lips like you're blowing into a balloon and exhale slowly. Get as much air out of your lungs as possible. This should take at least 8 seconds. When you reach the point where you have almost all the air out, you should feel muscles under your fingertips tighten and your belly button pulled down towards the floor. Do this for a few breaths. Then, place your fingertips into your sides. Now, as you exhale, pay attention to which side tightens first, if any. You may feel one side more, both sides equally, or neither side. You may even feel one side tighten more intensely than the other. Pay attention to this and take a few more breaths, trying to make both sides tighten at the same time and the same intensity, while your belly button continues to pull in towards the spine. Repeat this process several times a day until you're able to tighten those muscles without using the breathing. This is where I start most of my patients and where I start all of my own corrective exercise routines. Next, the posterior hip capsule. When the gluteal muscles have been asleep for years and years, the hip starts to sit forward in the joint, so the femur starts to sit forward. This typically results in a tight posterior hip capsule. So when you move, the hip joint pinches in the front, causing hip pain and injury to the labrum. So the next step is to help the femur move posteriorly or backward in the hip joint during the appropriate hip movements. Here's how you get started. Start on your hands and knees, bring one leg back behind you, and turn the other leg so the foot crosses the midline. This is called hip external rotation. Now, lock in the foot with the knee of the back leg. Keeping your belly button pulled in, shift as much weight over your turned leg as possible. You should feel pressure, a stretch, or both right through your butt cheek. We are using the femur to push into the posterior hip capsule, effectively stretching it. You can adjust the angle of pressure depending on where you get the least amount of pain and the most stretch. After you've done these 2 techniques, you'll want to get more eccentric control of the glutes and hamstrings. This means the ability to control the hamstrings and glutes as they get longer, which they need to do in order to hip hinge and squat without pain. Here's a simple way to start training this. Lie on your back with your knees bent and your back flat on the ground. You're going to need to decrease friction here, so use a pillowcase or socks if you are on wood floor or tile. Bring your heels as close to your butt as possible. Next, Bridge your hips up. You should feel your glutes and hamstrings squeeze. Slowly allow your legs to straighten and your heels to slide forward. Then return to the starting position. Your hamstrings will probably cramp, and that's a good thing. If they do, relax and wait for them to stop cramping, then perform the exercise again. Try to get a set of 10 each session, multiple times a day. You'll be sore the next day, but that should go away with time, and you should be able to feel your glutes and hamstrings control your hip movements more effectively. Now, before I let you go, I have a bonus golden tip. This tip will make those 3 steps I gave you way more effective. The most boring but incredibly important concept: consistency. When you give yourself time every day to work on your deep abdominals, hip mobility, and mindful movement, you get the best long-term results. How do I know this? Because when I miss a day, I start to feel my pain creep back up. When my patients report they were not consistent, they're usually in more pain. Not intense pain, but enough to know that something's off. Remember, the body was designed to move in many different ways every day, not to sit in the same position for hours every day. It is our gift and our curse to be able to move every day. However, if you want to live an active, healthy lifestyle free from pain, you must be consistent. Take time for yourself and your health, and integrate these changes consistently into your life. I'm confident you will start feeling better even over the next few days. Make sure you comment down below with what you found to be the most effective for your own hips, and subscribe so you don't miss any more videos about living life without pain. Thanks for watching.